So Moody's has concluded that Walgreens is downgraded to junk bond status, summarizing that Walgreens' debt is too high for earnings. Earnings are too low for debt, each specific to creditworthy bonds, and their healthcare exposure, especially to adding more healthcare services on the heels of judgments against Walgreens and other industry participants in the opioid crisis. We've done work with wholesalers and the New York Attorney General's office to put controls on place for opioid diversion at the wholesale level, at the pharmacy level, and also at the physician level, which is how we end up defeating the pharmacy benefit managers, is the proper police function. I've lobbied internationally to create an international jurisdiction that was there before in Australia, is a Fairlawn International Criminal Court, where drug criminals and drug diverters can be extradited and await trial. Particularly that a lot of those cases have some origin, on that other side of the world, and it can be adjudicated there. I've appointed 7 state patrol colonels from the United States to have credentials there to start extraditing drug criminals there. That is a process. So we're looking for funding. And here domestically, we offer the services of creating the control plan for wholesale and pharmacy diversion. We're also working with physicians on an option for BlueRx, an option that's in their clinic in the old tradition of Ayurvedic, which is a variously French, Lithuanian tradition of food as medicine, to be able to offer food and other prescriptions to help defeat food-based disease, whether it's diabetes or otherwise, which can include alternatives to pharmacy and include pharmacy based on the contract the physicians are willing to take on the space with their landlord. Moody's reports that the diversion prevention is basically the right service. That's what's missing in the marketplace. A lot of that work that I've done in my career isn't paid. There happens to not be a fee schedule at Medicare where I can get paid, which is unfortunate because the Joint Commission mandated paying scales back in the late 90s that required public health screening in the primary care environment, not like PACU patients or surgical patients, but public health screening, which caused the opioid epidemic, is one of the main drivers of the opioid epidemic. And we know that screening causes harm, and so Joint Commission failed. The way that Moody's has rated hospitals and clinics has basically failed, or it's led to consolidation. That consolidation is one of the drivers for the opioid epidemic. The Walgreens being broken into defunct pieces is another existential threat because they're slightly better behaving than other peers in that marketplace. Or as a Chicago-based company that tended to be a better corporate citizen than others, and yet Moody's didn't reward them at all. They're far worse performers out there than Walgreens. Walgreens, received poor English audit and poor English certified public accounting, which are fads. There were no certified public accountants at America's founding, nor during the Civil War. It's a foreign influence from England. None of those accounting firms are even American. They're not based here. They don't have kids in our schools. The accounting frauds that we've seen since the late 90s, which I've been involved in more than one of them. I can't even mention all of them that I've been involved in, where I come from the old French accounter tradition. We're the side that has applied more advanced math and analytics and management. Accounting has failed America so terribly. None of the big four accounting firms are even American. They're not based here. Their kids aren't in your schools. They don't care about your town, your state, your village, your political party. They're not from here. And they're low English, and it's a fad. It's a fad that doesn't go back before World War II. There were no certified public accountants before World War II. The accounting frauds that we've seen come from English accounting, which isn't a professional class of people. And they weren't on our side in the Revolution. They weren't on our side in the Civil War, and they're not on our side now. Whether it's with the Walgreens or with Moody's. And so what we seek to do is implement some alternatives, such as a BlueRx option for physicians, of which BlueRx is a brand that can be bolted onto physician offices. And some of the services that we'd like to be able to provide for your physicians, for your patients, is Blue Credit, financing entity to help administer charging interest to health insurers and outside pharmacy benefit managers. So to strike back the physician option that was there. And Divert Credit, a financing entity to help appraise the culpability of the opioid crisis to key vendors, whether manufacturers or pharmacy benefit managers. And one of the major pharmacy benefit managers signed a mutual non-disclosure with me back in 2016, of which they violated, and I have the federal government on my side to prosecute it, where I'm first in line in receivership for that company, which takes some time. It also takes appointing board members and getting interested parties, especially physicians, involved, where physicians are the right individuals to involve. Where the Dent versus West Virginia ruling by the Supreme Court in 1889 predates the certified public accountants being involved in healthcare, predates bond rating firms being in healthcare. Where Moody's was originated with rating America's railroads, which before Moody's was ever involved, America had the best railroads in the whole world, and Moody's ran them into the ground by saying they were not creditworthy. And it's like, when did railroads stop being creditworthy in America? They didn't stop being creditworthy. Moody's just failed, and our regulators failed to offer alternatives in the bond rating space. There's only 3 players, which is a mega neura, which is violates the Department of Justice sovereign right to horizontal guidelines in bond rating firms. And we have alternatives for that we've worked with our partners in Europe, NATO allies, household names, who have a real origin in rating bonds, including the French tradition, including the horse shepherd traditions in NATO allies. Guys are, their people were here in America involved in building West Point. We were on the side of the Union in the Civil War, including bringing the USS Leahy, which was the world's first submarine, to shut down the ports in the Confederacy. And so there's alternatives for bond rating firms. We're working on them with our partners in Europe. There's alternatives to Moody's specifically that members in NATO and the European Union are looking at and have responded favorably to. There's alternatives to English certified public accounting, which is just a fad, which has been a source of fraud and waste and money laundering and tax evasion. And not even that long, and not in a not in an interesting way. It's the contrived 1930s based origin of English accounting, which you can look back at English words, and none of this language that we describe as English have an English origin. If you look at the spelling, the phonetic, or the meaning on any word in a dictionary, it doesn't trace back to England. It traces back to our allies in continental Europe, which makes sense. It traced back to the guys that built West Point in 1773, who were Lithuanian, Polish, and some French. It traced back to the guys that brought down the Dutch Golden Age, which was known as the Continental Army, which was the same guys as French, Polish, Prussian, and French, and the guys that prevailed at Appomattox, Charles Louis Napoleon Bonaparte III, Ulysses S. Grant. And we need that scale of reform in accounting, in pharmacy benefit management, in bond rating firms, which, BlueRx is our solution for reintroducing physician involvement, medical science involvement in this thing that we describe as a pharmacy. And so join us at profi.me.